Alright, many individuals have had vision correction surgery in the past. With about 30 years of history, numerous people have been able to enjoy a more convenient life without the need for glasses. Still, even those who've had vision correction surgery can develop cataracts. They might need cataract surgery eventually. In the past, after undergoing corneal surgeries like LASIK or LASEK, the accuracy of predicting refractive power was quite low. Because of this, it was quite difficult to achieve the vision correction benefits needed to go without glasses after surgery. However, these issues have been significantly improved recently. Since cataract surgery is a different procedure from vision correction, it can be performed without major impact. Still, there are some variables compared to those who haven't had corneal surgery. Here is an example. 2 months ago, you had cataract surgery and received a multifocal lens known as the Zeiss ATLISA Tritoric. After the surgery, you experienced some discomfort, such as seeing 3 overlapping red lights at traffic signals and not much scattering of green lights. Usually, red light has a longer wavelength, which can affect vision more. You felt severe light scattering, making it hard to endure. You were told to try adjusting for 2 months, but you returned, unable to adapt. You had cataract surgery here. There was some posterior capsular opacification. In reality, by removing the posterior capsular opacification, one can achieve a significant improvement in visual clarity, and it also helps in reducing the scattering of light. Nonetheless, if the opacification is extremely severe and is the primary cause of the symptoms being experienced, we strongly advocate for its decisive removal. If this is not the case, removing it can make it difficult to replace the lens later, so you need to choose carefully. Now, when thinking about refractive power, especially for multifocal lenses, it's crucial to grasp its significance. Currently, you have +1 diopter of hyperopia and -1.5 diopters of astigmatism. Typically, if it exceeds 0.5 diopters, the quality of vision can significantly drop, and there can be considerable light scattering. You had LASIK surgery 12 years ago. There is some posterior capsular opacification, but I do not think it is very severe. There were no significant abnormalities in the retina. The macula was healthy. There were no indications of macular edema or any retinal problems. Thus, it might be associated with either the precision of the lens power itself or potentially the compatibility of the lens platform with the unique characteristics of your eyes. Now, looking at the state of the cornea, you can see the blue area in the center where the cornea was reshaped, and it looks relatively evenly done. In situations like this, I frequently recommend considering multifocal lenses. In addition to these aspects, assessing higher order aberrations and ensuring the correct alignment of the visual axis is crucial. Therefore, for those who have previously undergone vision correction procedures and are now considering advanced lens options for cataract surgery. Therefore, it's crucial to make a well-informed and precise decision. Now, looking at this, it analyzes higher order aberrations, which refer to irregular astigmatism that cannot be corrected with regular glasses. Higher order aberrations, which include phenomena such as coma or spherical aberrations, can significantly affect the quality of your vision. While the levels are not exceedingly high, you can notice an increase in vertical coma exceeding 0.3, which might have had an influence on the overall quality of your vision. Actually, more than that, the remaining hyperopia and astigmatism in the prediction of refractive power are likely the bigger issues. So, it's important to accurately match the prescription, and this patient mentioned that they do not mind wearing glasses sometimes for near vision. They also mentioned that they would prefer to have clear vision even if it means occasionally wearing glasses, but generally they do not want to rely on glasses. Considering all this, I'm confident that the Pure C lens is a great option here. I replaced the lens, and 3 months after the surgery, I also treated and resolved the posterior capsular opacification. As a result, the light scattering has almost disappeared. In these situations, it is quite common to observe a slight adhesion of the macula. Initially, there was some mild macular edema, but it gradually resolved, leading to improved and more stable vision. Consequently, the light scattering has significantly decreased. For distance vision, the shapes were clear. However, there was a lot of light scattering due to hyperopia at that time. With mild hyperopia, distance vision is usually quite good, but near vision suffers significantly. Although multifocal lenses did not provide clear near vision, the Pure C lens allows us to make strategic adjustments to bring the focus slightly closer. This improves near vision. However, distance vision may slightly decrease. By thoroughly evaluating all these aspects, we aim to customize the surgical method to perfectly suit each patient's unique needs and preferences, offering a variety of personalized surgical options for them to select from. Currently, what was previously hyperopia and astigmatism has now shifted to mild nearsightedness. The Pure C lens is specifically designed to induce a slight negative refraction when assessed using an autorefractor. The correction is well aligned. The patient's vision has improved to 1.0. Near vision has also reached 1.0. Intermediate and near vision are also good. There is no discomfort. Let me share a story about a very satisfied patient. Yes, everything went smoothly. If you trust us and come in, we will do our best to provide excellent care. Thank you.